Thank you, Mr. Speaker. On Monday, I called for an empowered chief medical officer in every hospital as part of the Wild Rose Plan to address the temporary ER crisis. It is critical that local hospitals have local decision-makers with the authority to deal with these issues quickly and efficiently. To the Minister of Health, will you commit in this House to designate someone truly in charge at every hospital who can open extra beds, move patients between wards and out of the ERs, and call in extra staff when these crises occur?
Not a charge.
Honourable Minister of Health and Wellness.
Mr. Speaker, that's a good question, and the answer is that's already happening now. Every hospital has what we call a site administrative lead, or words to that effect, or a site medical lead, or words to that effect. And at each spot along the spectrum, there is that local authority to work with certain situations, such as some of the ones that have been described.
Honourable Member.
Mr. Speaker, is the Minister actually saying that there is someone in our hospitals who can move ER patients out and into other wards that are more appropriate, call in extra staff, and to stop these unacceptable backlogs? And if they do, why aren't they doing it?
Right.
Honourable Minister.
Mr. Speaker, they are doing that, and as I indicated earlier, there are a number of beds that have been opened or will be opened over the next short while, and a lot of those were made by some of the people that they're talking about.
Honourable Minister, continue.
So just before I was so rudely interrupted by the member asking the question, if he wants some specifics about which hospitals are opening how many beds, I'd be happy to provide that to him. I have it with me, and I'd be happy to read it into Hansard.
Closing them too.
Honourable Member.
Yes, Mr. Speaker, they're allowing bureaucratic protocols and ridiculous regulations to sentence people to 12 and 24-hour terms. Again, to the Minister, we have 35 seconds. Will you take this simple first step of our health care and dismantle your complex super board and its stifling bureaucracy and regulations, and allow decision-makers in our hospitals to be accountable to patients instead of bureaucrats and ridiculous rules?
Honourable Minister.
No, Mr. Speaker, I find it very interesting that a party over there that calls itself so fiscally responsible wants to go back to a system where health care expenditures were growing by 10, 11, 12, 15, 20% in some cases. And we're talking about capping the delivery system at 6% increases. And those increases, Mr. Speaker, those...
Honourable Member,
yes, if they could just not be so rude, that would be helpful.
Minister has the floor.
So we're talking about guaranteed funding plan here of 5 years with specific targets in place, and those will be adhered to.